delighted to be chairing the next panel, and we've got a very prestigious panel and very interesting cross-section of panelists from around the world. We have the Right Honourable Damian Green, who chairs the All-Party Parliamentary Group. We have Adriane Berg, who is the Executive Director of the Kitalys Insitute and founder of the National Academy of Elderlaw Attorneys, host of Generation Polled, and member of the United Nations NGO on Aging's Communication Committee. And finally, very, very pleased to have His Excellency Dr. Amiri from the United Arab Emirates, who is the Assistant Undersecretary for Public Health Policy and Licensing at the Ministry of Health and Prevention. So I'm really, really pleased to have you all here. And I will go in turn to ask you to present your perspective on the sort of the policy and governmental response. And of course, we're very interested to hear what Adriane has to say about the new US situation that we have. But I'll start with Damian first, and I'll go to Adriane, and then we'll go to Dr. Amiri last, and then we'll open up for questions. So please do send questions on the chat. There is so much interest here, and would be so lots of questions to come through, I hope. So over to you, Damian.
Thank you, Tina. Thank you for inviting me, and hello everyone from the House of Commons in Westminster in London. And so I'll talk obviously specifically about UK government policy and what I think they should be doing. The government has committed itself to 5 extra years of healthy life and has committed itself to achieving this within the next 15 years. And it has put out a sort of consultation paper about this, but has not yet adopted a strategy. So the all-party parliamentary group on longevity that I chair has tried to be helpful and fill that gap by producing the Health of the Nation report that somebody mentioned in one of the earlier presentations, which really is sort of be taken up as a white paper, as a policy document for the government. And the lesson that everyone has learned from COVID is that health resilience, both on a personal level and on a societal level, is more important than it ever was before. And looking at the comparators around Europe and the rest of the world, Britain is rather unhealthy and rather unequal, and COVID has exposed that. And if the government is going to achieve its ambitions about a longer healthy span of life, then it is going to need to act fairly urgently and fairly radically. So we have come up with a number of recommendations about how the government can achieve that, all based essentially on the oldest law in the world, that prevention is better than cure, that in Britain we have a National Health Service that is designed to cure people who are already ill, and we don't pay enough attention, spend enough money on activities which we all know what they are, obesity, smoking, alcohol abuse, those kinds of areas. We don't do anything like enough of that. So among the recommendations in the report, perhaps the most stark was about money. At the moment, Britain spends about 5% of its budget on public health. We think that should quite rapidly go up to 15%. The way to grab attention is to increase it by 1% a year until you have hit a level where the government is taking prevention as seriously as it takes cure. The great second idea, the great idea of the government, apart from Brexit and dealing with COVID, is levelling up, of reducing those inequalities, both geographical and in other ways that bedevil Britain. We argue that essentially that should start with health. People talk about levelling up and often think of infrastructure or education and so on. Actually, health would be the biggest single game changer for Britain, because basically the top 20% of this country are where we would want the whole society to be. So it's not impossible living in modern Britain to achieve that kind of healthy life expectancy, but we need to spread it much more carefully. To do that, a third thought is that this needs a huge government effort. It cannot be left to health departments alone. It needs change to transport policy, housing policy, education policy, food policy, and so on. And we have advocated that this should absolutely come from the top, that the Prime Minister should lead this as a great national challenge. The fourth point that's been both by us and in a very good policy exchange report, and a think tank report came out this week, that the government is going to abolish Public Health England, which is the body responsible for public health, and this report thinks that the successor needs to be much more sharply focused on health span, if you like, that should be a key driver of that. The fifth thought is that local authorities, local government in this country need to be much more involved and much better funded to be involved in the whole health prevention exercise. They're given responsibilities without funding. It's never, for 60, 70 years, it's not been seen as a responsibility of the government. We think, and again, this is specifically from COVID as well, that this would be much better done with the kind of sensitivity and flexibility that you get from local government than you will get from top-down central government. And the final thought I have is that we are only in infancy of using data properly and using AI properly on this. That this could be a major driver of raising healthy lifespan and better health more generally through preventative measures, and that the technology is there, but it hasn't yet been applied in this sector anything like enough. Enough for me. Thank you, Tina.
Thank you so much, Damian. So, Adriane, over to you, and some thoughts on what's to come ahead in the new Biden presidency.
Well, first of all, thank you very much. This is a wonderful opportunity. And I do want to say that I'm kind of jealous because you asked, what is the U.S. longevity policy? And the answer is we don't have one. What we do have is an aging policy. And it's pretty comprehensive and there's not much division. But if you read our laws like the Older Americans Act, which was in March, just this March, reauthorized by both parties, no problem. If you look at our Health Resources Act that gave $51 million for education on COVID, again in March, billions that went through our provider funds because of COVID to hospitals. You will see, and if you read this legislation, you'll see words like vulnerable population, needy. Our look at aging is almost early 20th century. It's all about protection, and it's all about health or illness maintenance and cure. You've heard about this. It's very little about prevention and empowerment. We're not looking at longevity, we're looking at aging as a frail population that needs to be protected, and there's nothing wrong with that, but I will tell you it's bipartisan, it's across both aisles. And what I'm hoping COVID will do is change our narrative. If we change our narrative, we change our laws and regulations. And there's three ways of doing it. And I'm going to give you two very concrete areas that people may not realize that has happened in the US. So the three things that we're looking at, particularly at the Kitalys Insitute, which is having this mission for health span, we've heard the word health span, for across the board for all in the next decade. We call that the moonshot. And by the way, the United Nations also in its Day of Older Persons this year called Healthy Longevity for All the moonshot. So we're taking this moonshot. There are three parts of it. One of them you heard about in the panel on biology, and that is changing some of the thinking of the regulators that allow for pharmaceuticals, drugs, interventions to look not so much at disease, but at aging and the common causes of those diseases, so that interventions that would help us age differently, even reverse aging, certainly age less frail, would also be approved and approvable by our regulators like the FDA and others. So that's one part of what we're looking at. And that's, of course, the Kitalys Institute is pretty strong in that area. But there's a second part too, and that is getting education to the public. If you ask a geroscientist about their breakthroughs, the first thing they'll tell you is eat right, exercise, have less stress, and have life purpose. The same thing that the gerontologist will tell you and that your mother will tell you. So we need to get that education to every level of our society. And we're pretty good at it if we can get the ad council and the messages out. So that's a second pillar of this. But the third pillar is something that we don't hear about a lot, and that is our own place in society. If we do have this health span, and I think that we're not going to let this crisis go to waste. I think the COVID crisis has shown us that being vulnerable, not looking at prevention, as everyone has talked about, is not just costly, but it's also deadly. And we can change the narrative. But the folks out there, our own people, have to feel that it's worth living longer. And it's not just a matter of either being frail and elderly or having enforced leisure. There's got to be something that we're going to contribute in all those healthy years. So we have a three-pronged approach. And I will conclude with giving you some good news, or at least good examples that people may not know about, even those in the field. One is that obesity is just about as bad now as smoking was in our health, in our aging, and even in cancer. But we don't smoke very much. Why? Well, you can see what happened. First of all, we changed our regulations. Smoking began to be considered a pediatric disease because of secondary smoke through our regulators. Once that happened, we were able to put money into massive advertising, and we got the 800-pound gorilla in the act, which is the ad council, and we got those messages out. So it was a two-pronged. It was legislative and regulatory, and it dealt with science and geroscience, and it was messaging. We can do that here with aging. We can explain to the regulators that aging can be attacked, and we can explain to the public, once we do that, what they can do for themselves and demand of their medical community. Second thing is the Secure Act. And we just heard with regard to Longevity 2.0 at an earlier panel that older adults are terrific entrepreneurs. If we have a huge health span, we can become entrepreneurial. The entrepreneurs in this country that succeed 3 times more than most are over the age of 54. And the Secure Act, which was drafted under Obama, passed during Trump, is one of the most under the radar boosts to health span, because it recognizes from a tax point of view that we're going to work past our 70s. And it also helps entrepreneurs put together cheap, inexpensive ways of saving for retirement. So these are 2 very different things we can put together and make a difference.
Thank you so much, Adriane. Really, really interesting. And I know there's a couple of questions we'll come on to later, specifically about what's to come in the new Biden administration. Now over to His Excellency Dr. Amiri, very interested, and of course he will be presenting a more detailed view of what is happening in the United Arab Emirates. But yes, so very pleased to have you here to give your perspective and perhaps contrast, compare sort of what you've heard in what is taking place in the UK and the USA and your situation. Over to you.
Thank you, Tina. First of all, good evening, ladies and gentlemen. And it's my profound honor to join you here today talking about the longevity, which is very important for the human being. I'm quite sure that everyone knows that by every decade, there is an increment in number of the years added to the human's life, 2 to 3 years. But this probably could happen only in the countries which they have sustainable health programs, sustainable policies to support the human's health. I will just shortly share with you just 3 main pillars which it supports the longevity in United Arab Emirates. On the top of it is the public awareness. We are really concentrating on enhancing the public awareness program to make sure that our community, which we have almost close to 200 nationalities, will be able to have the healthy lifestyle and to avoid like a junk food avoid the smoke, avoid obesity, hypertension, cardiovascular diseases. You know, the healthy lifestyle could be not only with the I can say middle or the aged people, but our main target is the young generation. That a lot of policies, programs being implemented among the students at school, the governmental and the private schools. And we concentrated on them since more than 15 to, I can say, 18 years, that to give them a proper public awareness. And those are the future of our country, and how to allow them to learn about the healthy lifestyle and to protect them from the cardiovascular disease, from, you know, different type of the diseases, the either communicable or non-communicable diseases. And this will allow them to be healthiest generation at the future, and to support their is that implementation of the best policies, that those policies will allow you in predicting different type of diseases, policies to minimize the number of the cancer cases, the policies how to minimize the number of the prevalence of obesity, the prevalence of the smoke, any programs supported by the governments, that to make sure that we will be able to see bad behaviors. Despite that, this helps the people to be aware of their health while they are at home, their office, and they will be connected through the internet with their family medicine doctor, with their hospitals, with their clinics, that we will be able to predict any sort of complication that it could happen to them. And this will lead me to go to the third pillar, which is the prediction of disease programs, which is being implemented in my country. I will share with you two examples. Now, one of the examples that this has been adopted, a program in the Al-Qasimi Maternity and Children's Hospital, that we have a technology which, had a strategic partnership with the Children's Hospital in the United States of America in Chicago, that we will be able, after the birth of that baby, to be able to predict a sort of the hereditary diseases that it could lead to the death of the baby, and we will be able to protect his life and provide them with some sort of medication. Despite that, the other prediction programs, some of the programs being implemented, that we do the blood test and we will be able to predict any sort of illnesses that it could happen to that person, and we will be able to protect them and to make sure that we will protect his health, and this will allow the longevity in our country. And therefore, on top of what I have been said, the government of United Arab Emirates for the last 4 years decided to change the name of our ministry from Ministry of Health to Ministry of Health and Prevention, that by prevention, we will be able to predict those diseases and protect the human's life and allow them to have a healthy lifestyle, and this will support the longevity in our country.
Fantastic. Thank you so much for that. I'm just keeping an eye on time. I know we're running a little bit late. We might just have a very quick break in a moment, but we'll catch up the time in a bit. I think there's a few questions now. It's fascinating to hear what is happening in the United Arab Emirates, with education, this focus on prevention, which is really, really interesting. And I know, so I've just got a couple of questions, because I promised to ask one about what's expected with the COVID advisory board and the new Biden administration, whether that will refocus attention on aging. Because we have another question on aging as a disease. When will other countries also recognize? Because of course the FDA has been quite interesting in the sense that it is allowed the metformin study and looking at aging as the outcome measure. So over to you, Adriane, just to comment on that point.
Well, for the last point, we did have a wonderful conference called Targeting Medobesity 2020, and the FDA did participate, and I do think that their ears are open to this idea that aging not so much as a disease, but aging is a risk factor that is in all of our issues and diseases like cancer, like Alzheimer's, and we can focus on aging and not just individual diseases. With regard to the new administration, they have an enormous opportunity here, obviously. And again, right now, it is still reactive. When you see what the Biden administration is saying their plans are, it is cracking down on nursing homes, it is saving Social Security. However, Medicare has changed already to have much more virtual visits covered, age tech covered, and that is being discussed right now. So we have some emphasis on prevention that we didn't have before. But what I think the real opportunity is that I see is being looked at is what we would call the longevity dividend from a positive point of view. They're still looking at it as the cost of aging as opposed to the benefits of aging. But this is what we know out of the data from that administration. 2035, it is said that 1 out of every 3 persons over the age of 65 will need long-term care. That's not sustainable. It is simply not. And so because sustainability is part of the administration's look at all things, I think that's going to be one of the issues of sustainability that we could piggyback on some other things like environmentalism. And the last thing I'll say here is we have many other issues that have been going on, like Black Lives Matters. Well, there's a big longevity issue there. We know that there is longevity inequality. And there's been quite a bit of talk about programs that bring longevity equality to certain groups. But that has a trickle-up effect where longevity is looked at by all groups and demanded by all groups. So I see great opportunity here. And for those who don't know, much of this policy is instituted at the Washington Conference on Aging, which does not take place until 2025. If there's a second term, then it will be the Biden administration that leads that. And that is our opportunity for a real longevity policy, named that as a longevity policy in the US.
That's fantastic. Thank you so much, Adriane. A very quick, perhaps, comment from Damian before I ask the final question to Dr. Amiri on data and AI, actually. So Damian, do you want to just comment on sort of what we're doing in terms of addressing the health inequality piece? Because we had one question here about needing more funding locally, et cetera, but just some of the direction that is being taken in the UK in that front.
Yes, I think that's the point, that we have been spending, never enough, but large sums of money. But because we have a national health service, we've tended to do all of this nationally, and increasingly, as COVID goes on, it becomes apparent that in certain key ways, actually having decisions done locally and just having day-to-day operations done at a more local level is just a much more cost-effective and just much more effective way of doing it. So I think that will be, I hope that will be one of the key changes that we come to. We get a more variegated system in a way, but it has to be done, within, I think, targets for reducing the inequality. Because if we do that, then, as I said, that will get us to where we want to be, and frankly ought to be as society. So it's getting people to do things that other people already do, essentially, the way they exercise and so on. So we know it's not impossible, and it's I suspect a lot of it will involve work in behavioural sciences and that kind of activity, as much as, if you like, traditional medicine. But it's what Adriane said, that it's not just what experts tell you, it's what your mother used to tell you. It's what we're all brought up being told what to do.
Absolutely.
If we listen to our mothers, the world would be a happier place. But I think that may be a more general truth.
Well, and so this is a nice segue just to have a final comment from Dr. Amiri on the point of prevention. And of course, science and technology showing how much is is being revealed through all the scientific developments. So just turning for a final comment to Dr. Amiri, in terms of how you're harnessing AI and data, we often hear, obviously the Middle Eastern countries are very, very advanced in this respect in terms of the prevention focus of your country. Oh, you're on mute.
Yes, thank you, Tina. That's a good question. In terms of prevention, I will just share with you just 3 small examples. One of it is that we added a sort of educational program at the curriculum of the schools with the of education, that we will be able having the sort of preventional steps to protect them. Despite that, we had a strategic partnership with the road and transport authorities, with the municipalities, with different local Emirates, that to provide the community with the walking and biking areas that it has to be accessible to everyone, and to allow everyone to exercise. Despite that, the programs which was launched but with different Emirates, but I will share with you one of the examples, the Dubai Fitness Challenge, which was launched in 2017, which encourages everyone who is a resident in Dubai or other Emirates to comply 30 minutes of activity each day for 30 days. And this will be watched by the AI. It's artificial intelligence that you could load it in your mobile application, and it controls you and makes sure or assures the auditors that to give them an evidence that you exercised for 30 minutes every day, and then that will be graded. Those were sort of encouragements, and I can say tools which it was used to prevent the I can say either the communicable the non-communicable diseases, and this to support the community anyway.
Very interesting, and I'm sure we'll hear a bit more when you come on shortly with your presentation. So thank you so much to an incredibly interesting panel discussion, very